Are you wondering if sex therapy is right for you? Then stick around because in this episode of the Mental Health Toolbox, we're talking with clinical psychologist and sexologist Dr. Moali. But what specifically led you into the world of sex therapy?
Well, one thing that I find it very important is that pleasure is a form of actually political activism, right? Claiming pleasure and being able to build a healthy relationship with yourself, with your body, because something that you talked about multicultural challenges. People are from different cultures, they're different. But what I see, which is unfortunately very common, there is this complicated relationship people have with pleasure.
Despite the increase in mental health awareness in recent years, there remains to be a lot of stigma around mental health treatment, and the topic of sex therapy in particular remains somewhat taboo and ambiguous. In this episode, my aim is to remove some of that ambiguity and help answer the question, what is sex therapy, how does it work, and is it right for me? Dr. Nazanin Moali is a licensed clinical psychologist and educator in Torrance, California, an expert in eating disorders, chemical dependence, sex addiction, and is an AASECT certified sex therapist. She runs one of the top podcasts in the sex therapy space, the Sexology Podcast, and is owner of her private practice, Oasis 2 Care. You can learn more about her work by visiting oasis2care.com. That's oasis2care.com. So let's go. Hello, Dr. Moali, and thank you so much for making time to be on the Mental Health Toolbox video podcast today. I really appreciate you taking time to share your words of wisdom. Well, you want to share a little bit with our audience about who you are? And I know you have a lot to offer in a lot of different fields around psychology, mental health. So why don't you go ahead and introduce yourself?
Thank you so much for the invitation, Patrick. I love your podcast. I think it's great that you give people actionable tools and strategies that they can implement. So I appreciate that to be part of this mission. I'm a clinical psychologist. I'm a licensed in the state of California, and I'm also an AASECT certified sex therapist. My background is I work in the world of addiction, inpatient, outpatient, methadone clinics, and also I did my postdoctoral residency in treatments of eating disorders. And when people kind of hear about all of this, perhaps they think about what's happening. They are all unrelated. But what happened is, ever since I was a child, I was very comfortable talking about sexual health, sex education. That was something I was comfortable talking about it. And as I was helping my clients in my private practice, people have a lot of questions about sexual health. And the more I was able to talk about it, I realized how much there's a paucity of information out there. So that's why I felt that was necessary for me to get first proper education and training around that. And then I added that as part of my offerings for my clients.
Wow, that's fantastic. So there's usually like a path that, oftentimes in mental health world, it winds and we get different experience and different settings, practices, education, right? And then eventually I think find our stride, right? But you seem to have really sunk your teeth in, right? You didn't just dabble in a little, eating disorder. You did a postdoc in eating disorders. You didn't just dabble in substance use. You're certified there. You also have, I believe, certification in conflict resolution for couples, right? So you have the marriage counseling experience there, which makes sense. That would complement the sex therapy aspect, right?
Absolutely.
So, yeah.
Well,
what a wealth of information. You also have one of the yeah. Absolutely. Yeah. The reason I asked you on is because I have followed you for some time, and I, professionally and your podcast and on LinkedIn. And I just see that, the content you post is so important. And it's still, I believe, a taboo subject, sex therapy. And when I come across clients who are struggling in that department, I do oftentimes refer them to your podcast. So I because I've listened to it, I know it's legitimate. I know that the work you're doing is invaluable, and you walk the walk. You know your stuff. So I really appreciate you being on. And I know you could speak to eating disorders, which is a whole, large topic in and of itself that we could dive into. But and specifically, I know you're passionate about sex therapy. You run one of the top 20 sexology podcasts in the United States, or is it the world? I know it's popular.
Well, thank you.
And I know you're very experienced in sharing your wisdom. You have another podcast, right? That's full in Farsi?
Yeah. So my first language is Farsi. So my English podcast is about kind of interviewing colleagues and researchers because it's really important for me that the information I'm sharing with my audience is backed by research. And my Farsi show is just question and answers because there's just so many questions that people have, and that's what I do every week, and I love it.
Excellent. Excellent. I know your doctorate in clinical psychology is multicultural, right? Studies. So I would be curious. I know that's maybe a topic for another day, but how these topics even translate between cultures, right? If it's taboo in America, I'm sure it's could be a very taboo topic elsewhere as well, and access to care and all of that. So excellent. So I'm curious then, what led you into this field? I know you said your experience and your passions, but what specifically led you into the world of sex therapy?
Well, one thing that I find it very important is that pleasure is a form of actually political activism, right? Claiming pleasure and being
Mhm.
able to build a healthy relationship with yourself, with your body, because something that you talked about multicultural challenges. People are from different cultures; they're different. But what I see, which is unfortunately very common, there is this complicated relationship people have with pleasure, and
Mhm.
they kind of like sometimes people think that they don't deserve it, and I found that that was the challenge in people coming from all walks of life. And when you kind of rebuild this connection with pleasure, when you allow yourself to experience pleasure, that can be healing all around because people are coping with their pain through substances, with unhealthy eating behaviors. But if you're
Mhm.
able to work on yourself and your self concept and self worth and build a healthy relationship with yourself and the pleasure and all this kind of wonderful connections that you can build, that on its own can be very healing, regardless of what you're struggling with.
That makes sense. I mean, therapy in general, we talk a lot about self-love, self-compassion, protecting time for the self, right? Filling our cup first before we give it to others so we don't burn out, so we don't contain, and then, blow up on people, or start to get sick, right? And see somatic stuff come up because of all that containment, right? We have migraines or stomach pains or other illnesses oftentimes will manifest if we don't take care of ourselves, our mental health and physical health. Um, what do you see in your experience? What has been one of the biggest hurdles in getting people to buy in or owning the fact that maybe they have not been loving themselves in this way, or any challenges in giving themselves permission to even explore this sometimes taboo subject, even in the mental health world, is not, I think, talked about very much, right?
I agree with you. I think one of the biggest challenges is lack of proper sex education.
Mhm.
Regardless of what is your belief, your background, I think everyone deserves to have proper sex education. And even in the United States, there are some states that legally it doesn't. The schools are not required to give scientifically based sex education. So people from early on start to develop a misinformation about sex, and especially for many young women, they see in the media what sexy looks like. They don't know how it feels like. So they're very
Mm.
disconnected with their body. That is part of the challenge. And also, it's one thing that people don't know. It's common for most people at some part of their life, they're going to struggle with sexual challenges. It doesn't mean that you're defective. It doesn't mean that you're not good enough. It's just a matter of getting the proper tools and strategies. So I think it's a combination of lack of education and also this mindset that if something is wrong, there's nothing I can do about it, or
Mm.
I guess sex is not something that is for me, or there's type of people that they can enjoy from sex, and I'm not one of them. So it's really
Mm.
important to examine these narratives that we have and work on unlearning those.
Wow, that makes perfect sense, right? I mean, when you think about, I can't speak to other cultures, but in the American culture, at least growing up, from what I've seen, has and I don't think it's really changed, is that every other people have everything figured out, and if you don't, something's wrong with you, you know. And so sorry, but you missed the boat, kind of thing, right? Or you're not supposed to ask questions or not supposed to admit that there's a problem, right? Because that then people will think less of you, like a lot of other areas of life, right? But this is in particular an area that I think really hits the self-esteem hard, right?
Absolutely. And I believe that for most couples, sex is the glue that keeps the relationship. But unfortunately, growing up, or even in media overall, we're not exposed to correct representation of what is a healthy relationship with a partner. People think that everyone else having more frequent sex needs to look a certain way. And if they have challenges, then I guess that's it. And that's it. So they're not going to work on it. And that's what leads to many people get disconnected with their partners, and all the challenges that me and you as therapists see in happens in the relationship. One thing that's important to keep in mind is the definition of sex is very broad. It doesn't need to be particular behavior. It can be whatever you and your partner decides. So it's just a matter of keeping that connection alive in your relationship. Needless to say, there are 2% of people who are their sexual orientation identify as asexual, but it's very rare that I see both people are kind of like ending up together. So most of the time when people are challenged, they have challenges in the relationship, it's because of lack of informations or unaddressed challenges in the relationship that shows up as sexual challenges.
That makes perfect sense. I can even imagine with even the difference in genders, not to label things too much, but in the sense that just men and machismo, even like the idea of even asking for help, is mental health is already taboo, but then admitting that you have problems in that department could definitely become a hurdle, right? Just admitting that there's a problem. And for women, and like you said, the body image, the assumptions of the role maybe they're supposed to assume in society, and all of those things being disconnected with themselves. I can imagine, getting people to both, not just one. It's hard enough to get one person to ask for help, but getting two people to ask for help jointly, I can imagine that's very challenging. Yeah.
Absolutely. And most often people kind of first go to their relationship couples therapies and then they come for sex therapy. But the beauty of sex therapy is that it can be brief. Just because many people don't have the tools and strategies, they can get the tools, practice it, and the relationship had reset. But of course, there are at times that their issues are more complicated and multi-layered. But it's one of the few areas of therapy that I've seen people with a briefer model, they get really good results.
Yeah, good. That's good to know. That's reassuring. I think a lot of times when people think about therapy, they still have the idea of the lay on the couch for 10 years and free associate, right? Until something, they have an aha moment. But so it can be very directive. It can be very prescriptive. It sounds like it can, you can move the needle pretty quick once you get to work.
Absolutely. And that is very helpful for people to know that it's not going to be a lifelong commitment. It could be. I
Yeah.
love therapy myself. I'm in therapy
Mhm.
like last 10 years because I find it very healing and very supportive of creating a healthy balance in my life. But it doesn't
Mhm.
necessarily mean to be the same thing for everyone.
Yeah. Well said. Thank you for that. I'm thinking most therapists have a therapist because they understand the value. It's very nice to have someone in your corner. Oh, so so many questions swimming around through my head, but one that keeps popping up is, what does the process look like in seeking out a sex therapist? Because I think pulling the trigger on that, I think for someone who's not even a therapist or non-therapist, like what are you looking for? What should one look for in that process of accessing care?
Excellent questions because there's just so many misconceptions and
Mhm.
also confusing information out there. Sex therapists are people who are licensed therapists. So they could be psychologists, licensed master level clinicians. So those are people who are often have license within their area, and they got additional training in sex therapy. The reason I'm saying that sometimes people just go to their generalist therapists, and although, as we talked about, therapy is fantastic, but it requires some technical information when you do sex therapy. So my invitation for people is to think about, where can I find the resources of that I can find certified sex therapists? In United States and in Canada, there's this wonderful directory, which is ASAC directory. I'll send you the link. And all the people who are certified sex therapists, which is a vigorous process, they list their information. So we have sex therapists, and then with sex therapy, something that's important for people to keep in mind is it's purely talk therapy, because that's a fear that people have, that do I need to undress? Do I need to perform anything? None of those things. Similar to what you do with your couple therapist. You're coming in, you're calling them, asking them for consultation. And then if you want to do individually or with your partner or partners, all you do is, like, first session would be kind of like gathering information, and the person often helps you with reaching the goals that you want. How I do sex therapy is, like, I help people to identify their goals, and we create step-by-step kind of strategies that they can take to reach their goals. And partly at times it's going to be an assignments that they do at home. And sometimes people have this kind of fear of, oh God, if I go to a sex therapist, I have to do something that I don't want to. No, right? Like great therapists go with your pace and your goals, and keeping in mind your background and your values. So it's just about helping you to optimize your life and your relationship with self and other. We also have sex educators. So people can find sex educators in ASAC directory as well. These people are not therapists. They all, like, the minimum they have to have a license. They have to have a bachelor's degree and license through ASAC to do sex education. What does a sex educator do? They can teach you specific skills. Like, sometimes people hire them to talk to their children about sex, which is very helpful. Or they can teach them all kind of like a BDSM, things of those nature that require some skills. So that's a sex educator. And I think one other thing that people need to keep in mind is that your comfort with the person matters. So the therapist can be fantastic, but then when you're talking to them, you might not find the connection. Granted, talking about sex, it can be very difficult, but you feel that the person is not a good fit. You're not able to talk to them after like 2-3 sessions. My invitation is for people to either bring it up or interview with other people to see who would be a good fit. Because again, I haven't seen a person with sexual health challenges that they wanted to change their life that were not able to do so. So there is a person out there that can help you to create a life that you want.
Excellent. And I'm so glad you bring that up. There's a saying I remember in my training is that healing takes place in the context of the therapeutic relationship, right? Meaning that the relationship matters a lot, the chemistry between the provider and the consumer, right? Or consumers in this case. And so you're echoing that it's perfectly reasonable to shop around if you feel like you're not connecting with your provider, because that's super important, right? Yeah.
Absolutely. Yes. I agree with you. The relationship is where the healing happens, as you said.
Yeah. Excellent. All right. So when someone's seeking counseling, what helps you help them? Right. And when I think about other types of therapy, specific therapy, whether it's, anxiety or depression or a phobia or OCD or whatever it is specifically, when you're talking about the presenting problem, when someone's seeking out treatment for sex therapy, what can they do on the front end to help your assessment hit the ground running?
Well, I think first of all, it's helpful if they kind of start thinking about things in these different areas. I always talk about this with my clients when they start. When there's a sexual challenge, the issue can be in one of one of these three areas I'm talking about, or all of them. One is the relational issues. Many times I have clients that are coming in and they say that I don't want to have sex with my partner, or sex, like I have a performance issues. But we're talking about, they're so disappointed from what's happening outside their relationship because of the bickering, maybe history of betrayal, feeling not supported, then that's hard for them to be sexual with a partner. So that kind of thinking about what is happening. Is it their issue is relational? Issue could be physiological. I think something else that I invite everyone who struggle with sexual health is to go to your doctor and do some kind of a basic test. It's most of the time it's not physiological, but it's helpful to give you information. For example, sometimes people have performance issues because there's a hormonal component to it, whether for men or women, people of all gender. So it's important to do some kind of a test and see what is happening. And the other area that I invite people to think about is sexual skills, because in reality, so the relationship is important, your health is important, but sex isn't a skill. So it's important to see, okay, where am I? And there's no shame on not knowing, because most people, they learned about sex from their schoolmate when they were in middle school, or they kind of from porn, and no one told them about the skills required. So I think also thinking about that is important. That when I'm struggling, like if I'm struggling right now, what is the area that I need to focus on, and start thinking about that. And in therapy session, then with a clinician, they can kind of focus on, okay, these are the areas that I think is an issue, working on that, and kind of the collaboration with the therapist, cultivating the skills that they need.
So sounds like it's not always just what happens in the context of the bedroom. A lot of it is the ancillary stuff, right? That influences the state of mind, maybe in the bedroom. That could be like you said, the communication, the approachability between the partners, right? The external stressors. I imagine things like financial stress, like I said, health factors, right? All of those things play a part, right? And so figuring out how to maybe break those up and look at them as individual things, right? Contributing factors.
That's right. And sometimes when we're struggling in the bedroom, it impacts our relationships. A common pattern that I see, that like one of the partners struggles with performance anxiety and they're not able to quote unquote perform. And then what happens is they don't want to feel, though they don't want to be intimate with their partner because they feel embarrassed, and they avoid sex. And the partner, meanwhile, thinks that their partner are not desiring them, there is something wrong with them, and then therefore it shows up in other parts of the relationship and leads to a rupture possibly for a couple.
Okay, so it's like this negative feedback loop, right? One person's ashamed, the other person feels rejected, and then it just kind of that leads into a lot of assumptions, right? What's not said, right? It's not communicated directly, is left to assumption, and sometimes that's not a good thing. Most of the time. Right. Have you noticed any and this is a silly question, let me know, but I'm wondering, do you see any kind of ratio or pattern in terms of like the most prominent issues you come across, maybe some of the easier ones to address and some of the more complex ones?
Absolutely. So my, I guess like the disclaimer is, majority of people in my practice are heterosexual individuals and couples that they are in a kind of a heterosexual, mostly monogamous relationship. So that's what I see in my practice, because I think the demographic kind of like in a
Thank
way
you for clarifying
defines
that.
defines
Yes,
that. So the challenges that I see in among couples, one is desire discrepancy. So one partner wants sex more, the other partner wants it less, and that creates a challenge. So that is one of the things I see. I see a lot of performance issues, whether for men and women both, and they're relatively easy to address, because thank God we have really good, solid protocols and research-based strategies in helping people to overcome any performance issues that they have. So that is part of that. The other thing that I see for couples is struggles to connect after experiencing betrayal. So most couples, what happens is when there's betrayal, there's cheating, they go to couples therapists and they work on, hopefully they work on some
Mm-hmm.
part of the kind of like the challenges in the relationship. But if it was a sexual infidelity, that can show up in their sex life. So
Right. I wasn't
uh,
even thinking about that, but yeah, of course. Right.
yeah, there's just
Yeah.
like so many people that they want to say, okay, we want to put that behind us. We want to connect sexually. And I have individuals that is saying that I'm getting flooded by the memory of my partner being with another person. So that is part of it. On the individual front, there are for like performance issues are common for many women. What I find very helpful that it's my own personal experience that also led me to sex therapy is painful intercourse.
Mm.
So it's unfortunately very common. It's definitely uh, prevalent in Western communities, but I know that even research shows that 40% of women from more conservative background they experience sexual pain during
Mm.
intercourse at some point of their life, and the solution is there's steps and strategies that will help you to be able to have great experiences. That's how I was a graduate student, and I didn't even know that the field of sex therapy existed. I was
Mm-hmm.
referred to a sex therapist because of the painful experiences I had.
Mm-hmm.
And now 25 years, 20 years later, I never had those experiences. So sex therapy
Mm.
can help you to eradicate that as well. And I think also low desire is some things that we see that can be complicated. But when you learn what leads to low desire for you specifically, I'm sorry, for people of all gender, you learn how to tackle it. So that's also something
Mm-hmm.
else that I see.
Makes sense. Yeah. Libido,
Mhm.
right? Sometimes different needs, right?
Mhm.
So try and get on the same page. And I had no idea that that was such a high percentage of women who have struggle with pain in that department. So that's an important, I think, aspect to understand as well. And the reason I really appreciate you sharing this information because for many of our listeners, because this is such a taboo subject, oftentimes, unless someone's doing a lot of digging on their own, a lot of research, this well, you don't know what you don't know, right? And people oftentimes think that they're the only one or they're kind of the odd man out, odd woman out. And so I think it's helpful to understand that the prevalence of a lot of these things, you know?
Right. And the misinformation that I remember when I was struggling, first person I talked to was my gynecologist who was a male provider. And he
Mm-hmm.
said, I don't see anything physiologically right. Perhaps you can drink a glass of wine and that would be more
Mm-hmm.
comfortable, like numbing the pain.
Take
How
the
would
edge
that
off.
be
Yeah.
the solution, right? That they're
Yeah.
just well-meaning people give you advice that you try and it's not working, and then it leads to you feeling more hopeless. So I
Mm-hmm.
appreciate that you're talking about people doing their own research and kind of like thinking about what are some of the tools that you can
Mm-hmm.
incorporate. And it's just a matter of cultivating tools and strategies to eradicate pain. And one really important thing for people to keep in mind that regardless of type of sexual act you're doing, unless you want it to be painful, it shouldn't be painful, right? That like
Right.
if it's painful, you have to stop. There's something wrong. Your
Mm-hmm.
body gives you the
Mm-hmm.
signal that I'm not ready or this is not working for me.
Mm-hmm. Good. So communication,
Mhm.
absolutely, with your partner, right? Instead of just trying to white knuckle it, for their
Mhm.
sake or whatever, the guilt and all the stuff that comes with that and sense of responsibility. And I'm sure all of that can play a part as well, culturally speaking, right? The role one is supposed to take in a relationship. So, yeah, absolutely. Right. So lots of tools available, which is reassuring, right, for everyone. What are some of the barriers? What are some of the challenges that you have come across that can derail sex therapy or progress, I should say? So maybe some of the pitfalls.
Sure. I guess one thing is that to kind of like the first thing that comes to my mind is that people think about just going to a sex therapist on its own will you will see the results. It's
Mm-hmm.
great, but it's like going to a physical therapist and not doing your exercises.
Mm-hmm.
So
Great
it's
analogy.
important for you to practice the strategy, implement it in your relationship, and see if it's working or not. That is one thing. The other thing is I hear, and I'm sure you hear that at times. I think it's for all types of therapy. People say like, I went to therapy and it didn't work, and I asked them how many sessions you went. They said one session.
Mhm.
Right? Like the first session, you're just gathering information. Like
Yeah.
therapists can give you some gems that you can apply, but it's not going to be for majority of people wouldn't be enough to see the results. So
Mhm.
I would say that if you want to see a result, if you find someone that's a match and you feel they're uh, kind of have the tools and strategies, just stay with it for a few sessions and see what happens. The other thing that's important for people to think about is the mindset piece, kind of like thinking
Mm.
about that it doesn't worth it for me, or I've never been sexual, or sex wasn't
Mhm.
something that wasn't working for me. So it's really important for people to think about like I deserve to experience pleasure regardless of your
Mhm.
background. I truly believe it's connected to sexual right is human rights, that for
Mhm.
you to be able to experience pleasure and lean
Mhm.
into it. So I think that's kind of like the thought that I'm not deserving also, that can get in the way.
So the belief system, like you said
Mhm.
before, the narratives, right? Oftentimes, maybe we're taught
Mhm.
growing up, right, or
And
what we
yeah,
experience. Mhm.
absolutely. I love you. You got me so excited. And yes, and all for
Mhm.
many people, all of those big T and small T traumas they experience during
Mhm.
sexual encounters, the messages they got.
Mhm.
We both know that how our field right now, somatic therapy is a huge thing, and our body remembers things. So if you had
Mhm.
bad experiences, that also can lead to your how you enthusiastic you are about sex.
Or is that there's a book about that, right? Body Keeps the Score, right?
Right, right. I
Yeah.
love that book. Yeah.
Yeah, absolutely. So something to consider, right? Because sometimes I imagine sex therapy, when you're talking about these things, you can really open up a deep well of other history, be that trauma, right?
Mhm.
Which can be helpful, I imagine, for a partner to understand maybe the context that they didn't necessarily take in consideration before, because we're all kind of egocentric, right? And so assume everything is about ourselves. But if a partner hasn't shared, the extent of their sexual trauma, or how that might come up during their own intercourse as a couple, right? I imagine that would be invaluable, like to unpack in therapy. Yeah, as a hurdle, right? Something that can be addressed, something to be talked about, right? Sensitive to, at least.
Absolutely. And sometimes people just don't have that memory. I had many couples
Mhm.
that as we work through things and they slowly start remembering things. And I don't want people to think about you have to resolve all of your issues to have great
That's
sex.
good.
It's just
Yeah.
like there are different puzzles that like if you put the puzzles together, you might get more information about what are some
Mhm.
of the barriers. And of course, it's your story if you want to share it with your partner or not, but
Mhm.
it's important to be able to recognize the role all of these are playing. And one of the wonderful things that one of my colleagues say, Dr. Batshiva, she talks about sex being sex being a point system. So it's like,
Mhm.
for example, you might need 100 points in order to have good enough sexual experiences.
Mhm.
And that could come from different places. So maybe you're working out your trauma and gives you 30%
Mhm.
additional improvement. Or maybe you can change on your lifestyle because we know sleep, diet, all of those things are
Mhm.
important. So maybe that can give you additional 50%. And the
Mhm.
other 20% can come from the relationships and sexual skills. So kind of thinking
Mhm.
about like where can I get points in order to
Mhm.
be able to have the experiences I want.
I really like that, because then it makes it more tangible, right? As far as like it's not this kind of ambiguous monster you're trying to tackle, right? Or puzzle you're trying to
Mhm.
solve. Like I like the point system thing, because that gives us, it's empowering. It would be for me.
Mhm.
Like, okay, so if I can get 20 points toward my 100 just by changing these things in my diet, aka like for men,
Mhm.
circulation, things of
Mhm.
that sort, maybe some weight loss, eating healthier, eating your
Mhm.
vegetables, right? All that important stuff, which, your healthy fats and all, the men food, as it's called,
Mhm.
right? Um, if you can get points back, you know, on those low hanging fruit type, no pun
Mhm.
intended, but low hanging fruit, um, that's reassuring, right? Because that's something, right, toward the goal, right? Kind of gamify it a little bit. Yeah.
Absolutely. And it can come from all the places. Some people are changes of lifestyle is easier for them.
Mhm.
Then
Mhm.
they can go all in there. For some people, the relationship piece is their strength. you can get point there. So it's not a one size fits all. So I agree with you that point system often also resonate with my clients a lot, because then they can see what they need to do.
I like that. Great. See, that's why I asked you on, because I knew you would simplify and demystify this stuff for us. So I appreciate that. Yeah.
Thank you. It was my pleasure to be part of your show.
Yes, thank you. I'm wondering too. I know you provided the ASECT as a directory, right? Which is great because sometimes psychology today doesn't cut it, and we're looking for something really niche, right? What about other resources? If somebody wants to educate themselves, or a couple wants to educate themselves before seeking out counseling to maybe get some frame of reference, what are some good resources to tap into? Any off the top of your head?
Sure. So there is this website actually from Kinsey Institute. I recommend it for women. It's called omgyes.com. It teaches you the skills that you might not have learned anywhere else. And it's not porn. It's just kind of women talking about what works for them. And even with my most conservative clients, that's resonate well with them. I also in my show talk about science of sex and pleasure with other colleagues that they kind of like have research on those areas. So having a sex education, honestly, proper sex education with your partner, I think would be very helpful. So you can check out my podcast, Sexology. And I think overall podcasts, like listening with your partner, I think can be really good. There are several great podcasts out there that get people listen and kind of like talk about it with your partner. That could be a good resource. For men, there is this wonderful book that my colleague wrote, Sizzling Sex. And it's talk about all aspect of male sexual health, from the kind of like going through different stages to sexual dysfunctions to kind of like challenges with your partner's sexuality, how you can support them. So that is also a very good resource. And for women, one of the very well-known books are the She Comes First by Ian Turner, that the partners, like, they teaches partners their skills to how they can support their partner. And Emily Nagoski book also, find Dr. Emily Nagoski's book is fantastic, Come As You Are. Like, it gives lots of good information. So yeah, I interviewed all of those colleagues as well. So I think like reading with your partner, listening with your partner, like depending on what your learning style, that can be really positive.
Excellent. See, that's why I asked. If I hadn't asked, I wouldn't have known. That's fantastic. Thank you so much, Dr. Moali.
Sure.
Appreciate it. And I really want to respect your time. I could keep going. So many questions. Such a great field that I just don't think is talked about enough. For those of our listeners or viewers who want to dive in, learn more about you and the work you're doing, where can we find you?
Well, they can check out my podcast at sexologypodcast.com. It has all the information about my podcast episodes. I do blog weekly, so they can find the information there, and they can find all the resources. Oh, well, thank you.
Yes, this is your website, right?
Yes.
Excellent. Yeah, so Sexology, right?
Yes.
I love your. I've always been a fan of your logo. It's very crafty.
Thank you. Appreciate that.
Yes, absolutely. So you obviously have a renowned podcast, right? Sexology podcast. This is your website. This links to your podcast, I imagine, up here. Podcast episodes.
Yes. So you have the episodes there, yes, and people can go from the homepage as well.
Excellent. You have a course?
Yeah, I actually have two courses. One for couples with kind of like desire discrepancy, and I have one workshop actually for men for struggling with performance issues. They can attend it with their partner, or they can attend it alone. So I teach them all the skills they would require to please their partner and also themselves to have a great experience.
Excellent. Wow, I love their titles. They're very crafty.
Thank you.
So you've also been featured in Men's Health, Insider, Huffington Post, Yahoo. I mean, yeah, you're definitely. I know you're a popular therapist in the LA area.
Well, thank you. It's very kind of you to say all of these wonderful things.
Very true. Excellent. And your socials? Are you on social? I know
Sure.
you're
I
on
think
LinkedIn.
people can check it out, like Nazanin Moali, and Instagram also. They can check out,
Mm-hmm.
the handle is at
Ah,
Sexology Podcast. And
mm-hmm.
yeah, so there's the links also in the below the website as well. And I started
Excellent.
a YouTube channel, so they can just Google my name there as well, to give kind of like
Oh,
video learning is something that you prefer.
absolutely. You have a YouTube channel?
Yeah, yeah. It's like if
What?
people put Nazanin Moali, they can find it there.
Like you're hiding this, you're like holding out on me here.
It's a newer thing. Like I've been doing it
Yes,
couple months.
definitely. Yes, yes. With the nature of our short attention spans these days, I think video is
Mhm.
definitely appreciated. Excellent. And your practice is called oasistocare.com with
Yes,
the number
yes,
2, right?
yes, yes.
Excellent. All right. Well, thank you so much, Dr. Moali. I just can't say thank you enough for making time today. I know you're a busy woman and got lots on your plate. So I do appreciate it.
Well, thank you, Patrick, for having me on. Thank you for creating this wonderful resource for the community and being so generous with your time.
Yes, it's my passion project and my pleasure to raise mental health awareness and
Mhm.
um in all its aspects. So thank you so much. And I wish you a fantastic week. And if it's not too much to ask, maybe I'll have you back on down the
I
road.
would be happy to.
Again, I'm sure we can go down lots of different rabbit trails between sex therapy and eating disorders and substance abuse. I mean, you've done it all. So do appreciate you. All right. Feel free to use the link anytime you want to jump back on to self-schedule. You're always welcome.
Thank you.
All right. Thank you so much. Well, I hope you found that helpful and informative. Hey, if there's any specific questions you would like Dr. Moali to answer around sex therapy, eating disorders, or chemical dependence, please just let us know in the comments below, and I'll see about having her back on the show to do a little Q&A. Hey, if you're getting value and you haven't done so already, be sure to hit the like button on this video and subscribe to the Mental Health Toolbox YouTube channel and podcast. If you're listening to this on the podcast, I would greatly appreciate it if you are getting value to please take just a minute and leave a review. It really helps to push the podcast out to more people and raise mental health awareness. And also be sure to share with family and friends. All right, so there you go, another tool to help you thrive. Until next time, make good things happen. Bye-bye now.